Okay, aloha everyone. We're gonna get started at 7:01 p.m. and I want to be respectful of everyone's time. So just wanted to give a big thank you for joining us. This is the COVID-19 Town Hall for Pro City, ʻAiea, and Lower Hālawa, and this event is being sponsored by Senator Donna Mercado Kim, Senator Clarence Nishihara, Senator Bennette Misalucha, Representative Sonny Ganaden, Representative Ling Johanson, Representative Sam Kong, Rep Gregg Takayama, Rep Roy Takumi, Councilmember Brandon Elefante, and Councilmember Radiant Cordero. So we do have our elected folks on the call with us, so really want to thank them. And really the purpose of tonight's town hall is to bring members from the Department of Health here to do a presentation about the current state of the COVID-19 pandemic and to share some info regarding the COVID-19 vaccine. And tonight we have two of those members from the department with us. First, we have CJ Johnson. CJ is a COVID-19 Community Outreach and Education Program Specialist. He'll be doing a presentation, and joining him, and she may be joining a little later, is Telly Matangi. She's a contact tracing lead investigator who has been leading some of the on-the-ground COVID work in some of the communities across the state. So without further ado, I'll hand the floor over to CJ Johnson, who will be sharing a presentation with us. So CJ, the floor is yours.
Thank you so much for having me. Thanks for hosting, Jacob. I really appreciate it. Thanks all of you for coming on this Tuesday night. So my name, CJ. I'm the Community Partnerships Lead for the Department of Health COVID Outreach and Public Health Education Initiative. They call me a public health educator, but really I'm just as committed to educating the Department of Health as I am in educating the community. It's really important for us to listen and understand what community needs are. So I'm going to share a little bit of a presentation just on some of the basic stuff, and then I'd really love to hear back from you all. So if you do have questions, even right now, if there's anything that you're interested in making sure that we cover, or if there's any questions as I go through this, please throw stuff in the chat. We would love to hear from you, and again, can help answer your questions, and it also helps inform our outreach and helps us better understand what community needs and what community concerns are. Because we have entered, I think, this phase of the pandemic where the community level and even one-on-one level conversations are going to be a lot more persuasive, right, to get the rest of our community protected and vaccinated than media campaigns or incentives are. And what that means is that it's important for everybody who has a platform to have the confidence to be a vaccine ambassador, to be able to answer those tricky questions. That's what I'd like to do tonight a little bit. But I do always like to start by sharing that most of what I'm going to share tonight and talk about tonight is available at the official Department of Health COVID website, which is hawaiicovid19.com. We have a ton of information there. Data dashboards, we have printable flyers, we have calendars, maps of testing and vaccination locations and disease activity, work and school guidance, a home care book if you test positive and you have to isolate or quarantine or your contact. We keep that updated. We have a lot of information. And most importantly, we translate all of our public-facing guidance into 20 languages and make it really easy to find. We really want to make sure that people who prefer to get their healthcare information, their public health information in languages other than English are served by our outreach. So please check it out, hawaiicovid19.com. You can also subscribe at the bottom of the page for updates, so you don't have to keep checking back. We'll send you updates when we've added new documentation or changed anything. And of course, we are very active on social media, especially on Facebook and on Instagram, to help provide the latest updates. So if you were only listening to headlines and you weren't watching really closely what's happening, you might think that we are locked into this standoff between vaccinated people and unvaccinated people in Hawaii. But the truth is that we've been making really steady progress in protecting our communities and our families from COVID-19 since vaccines first became available way back in January. And as of this week, only about 9% of eligible Hawaii residents have not yet committed to starting the process of getting vaccinated. I think that's a really important number. I think sometimes we focus on that completed population, but when you look at it this way, so what this is folks who are are eligible, that's 12 and over, who have started, who have initiated, said, I want to get vaccinated. Almost everybody, right? We're over 90%. And I think that's really important. And even this week, right? This week, in the past week alone, over 5,000 people in Hawaii have made the decision to get vaccinated. And another 5,000 got their second doses. And what that tells me is, far from a standstill, there are still thousands of people out here who are unvaccinated, but still open to getting vaccinated. And whatever their reasons or for waiting, or whatever their reasons for finally committing now, we have an opportunity, and in some cases, for me especially, an obligation to do whatever we can to help them make more informed and confident decisions about their own personal health care. And I know that there's a lot of confusing information out there, and sometimes it's deliberately confusing. I also know that a lot of people have good reasons not to trust the government or our healthcare systems. And you're here now, and I appreciate that. It means to me that either you're looking for more clarity for yourself, or you have a professional role that puts you in a position of credibility and authority with a community, and you want to be more thoughtful about how you use that, or you're a concerned coworker or family member or neighbor or congregant, and you just want to have a little bit more confidence and a little bit more information when you talk to folks who aren't fully on board with getting vaccinated. My goal is that whatever category you fall in, maybe you're more than one category, that you'll come out of the session a little bit more confident and have a little bit more information. So before COVID, most of us didn't think about pandemics very often at all, right? But to the people who did, thanks to those people that did, the experts who studied the ashes of past pandemics to look for clues, studied our frequent near misses, each time a pandemic emerges, we're a little bit better able to respond. We have slightly better tools. We have new strategies to curb the suffering that they bring. And that's really important when we talk about this kind of big picture, that neither vaccines nor pandemics are a novel thing in humankind. They've kind of been haunting us for the whole time, right? Even going back to the Bible, we know that viruses and pandemics have been a huge threat to humanity all along. But what are they, right? What is a virus actually, what is it actually doing? A virus is really just a piece of genetic code that replicates by entering and hijacking a host cell and using that cell's proteins to create copies of itself until that cell bursts, and those copies spread out in your system to make more cells to hijack, or to hijack more cells. So I think people worry sometimes about vaccines altering our DNA, but the reality is viruses are DNA tweaking monsters that turn our cells into little virus factories, right? I think it's really important because what that means is, since viruses use host cells to replicate, genetically, that means that every virus is part virus and part host. So every time a virus jumps from one person to another, it mutates and creates a new variant. And most of those mutations, most of those variants, they don't really change the way the virus behaves. It's just kind of like a new haircut. But every once in a while, you get a really significant variant, and that variant could be more contagious or more severe or more resistance to the defenses that we have against it, like vaccines and therapies. And when any of those things happen, the variant becomes a variant of interest. And then when it starts out competing other variants, we call it a variant of concern. And that's what we've been hearing a lot about with Delta, right? Is that it's a variant of concern. And the key reason is, one of the reasons that we don't talk about as much, for it's so important for everybody to get vaccinated, is that the more transmission occurs, the more likely it is the new variant of concern will emerge. There are a lot of reasons that it's important to spread the curb the spread of COVID, but that one, right, cutting the chance of an even more dangerous than Delta, is one I think maybe we don't talk about quite enough. And speaking of Delta variant, right? You probably heard the term, when we talk about viruses and the way these things move, exponential growth, right? Viruses spread exponentially. And all we mean when we say that is that they don't spread from 1 to 2 to 3 to 4 people. They spread a little bit more like this. So in the first case, this is going back to the January, February, March of last year, that original strain of COVID had a growth factor, a growth rate of about 3x. And what that means is that each person that got sick, on average, was going to get another 3 people sick. And that in and of itself was really concerning, because of course 3x means that those 3 people each get another 3 people sick. So in just a couple of generations of spread, you have 13 people sick from that one original person. And that's a really alarming rate. But the Delta variant, which is where we're at now, has a much faster spread rate. It has an 8x factor. And what that means is that each person that gets sick is likely to get another 8 or so people sick. And then each one of those people is going to get another 8 people sick, and so on. So it's not a small difference, right? It's the difference between 13 people in 2 generations of spread versus closer to 7 73, 74 people in in 2 generations of spread, and that's a big deal. Why is that? I've heard a lot of different explanations, but one of the ones that I really liked that helped me was someone said it's the difference between getting honey on your fingers and trying to get it off versus getting Gorilla Glue on your fingers and trying to get it off. That's how much stickier the Delta variant is than the variants that we saw before, and why, even though so much of the population is vaccinated, we saw such a horrible surge earlier this year. So because pandemics have been so deadly to humankind over the centuries, vaccine science is actually one of the oldest and most widely studied branches of medicine. Scientists have known about vaccination to stop the spread of disease longer than we have known about, this is true, longer than we've known about hand washing before surgery, right? So when we were still packing sawdust into surgical wounds and weren't even bothering washing our hands, we already knew that we could use vaccines to curb the spread of disease. It's really well established. It's really old, proven science. Probably heard the expression, ounce of prevention is worth a pound of cure. And that's really what we're talking about when we talk about vaccines. And they work in a really clever way. When our immune system meets that new virus, that novel threat that it's never seen before, it has to study it. It has to observe it to see how it acts and learn how to stop it from multiplying, create the tools. And then once it learns, it has to build up enough of those tools. And while it's learning, as we saw earlier, that virus is hijacking cells, blowing up cells, spreading out. So you've got kind of an arms race going on, right? Between that virus and your antibodies that your own body's creating to defend itself. Well, what if there was a way to speed that process up so that your body was prepared in the first place? And that's what a vaccine does, right? A vaccine is a tool that gives your body a head start at creating its own defenses so that when it meets that new virus, it's prepared. Vaccines don't stick around in our bodies and fight viruses like other medicines do, right? When we take an antibiotic, the antibiotic is actually in there doing the fighting for us. Vaccines don't work that way. Vaccines help us protect ourselves. They're more like teachers than they are soldiers. And that's an important distinction, because what it means is that if we wait until we're already sick to take a vaccine, it's not going to help us, because all it's able to do is get our defenses spun up quicker. And once we're already spinning up our defenses, it doesn't help at all. So vaccines work, we describe the way that vaccines work in 3 ways. They reduce the likelihood that you'll get infected if you get exposed to COVID-19. They reduce the likelihood that you'll get sick or die if you get infected by COVID-19. And they reduce the likelihood that you will pass COVID on to someone else if you get infected with COVID-19. And those are all related, but they're distinct. And we'll talk about why in a minute here. But 2 of the currently available vaccines, Pfizer and Mrna, and I know this is a big subject of interest, are mRNA vaccines. So mRNA was first identified as a potential way to improve medicines and vaccines and other therapies as early as the 1960s. mRNA, messenger RNA, is just that, it's a messenger. Another way to think about it is like a photo of a virus's weakness that your immune system studies to help prepare. So mRNA vaccines don't contain any elements of actual coronavirus or any other virus, so they can't make you sick. They can't give you COVID. They can't infect you with any sort of virus. And we know from decades of study that mRNA breaks down and is flushed out of our system within days of delivering that information that teaches our immune system how to protect itself, how to defend itself. It also it doesn't enter the centers of our cells, which is where our DNA is, and it doesn't cause long-term side effects, because again, we know that the action is very short-term, does its job, gets out. It is not associated with long-term side effects years down the road. This is a big one, I know. Even against the Delta variant, current vaccines are still really effective, really effective at all of the things that we hope that they do. As a recent CDC report showed that unvaccinated people are 5 times more likely to become infected and 10 times more likely to be hospitalized or die from COVID than vaccinated people. And vaccinated people, I know this one's a little bit confusing. There's been a lot of kind of back and forth on that. There's some concern, well, can you still spread it if you're vaccinated? And it looks like there is still a window where if you get infected and you're vaccinated, you may still be contagious. But what do we think now is that you're less contagious for one thing, and then you're contagious for a much shorter time. So if you are unvaccinated, you're likely going to be contagious for like 8 to 10 days, whereas if you're vaccinated and contagious, probably half that, maybe 3 to 4 to 5 days, somewhere in there. So there's still huge benefit for all of those things that vaccines do. They still do against the Delta variant. Now, I want to take it back to that exponential. Remember, we looked at that earlier, with the exponential growth rate. Well, this is where vaccines are especially important. To give you an idea of how it looks, what I want you to think about is, we have these 8 people, right? Well, let's say let's say 6 of these 8 people, so 75% of these 8 people are vaccinated. Well, what does that do to our spread rate, right? Well, in that case, most of those people in that 3rd generation aren't going to get infected, right? Because 5 of those 6 people who were vaccinated aren't going to get sick, and they're not going to be contagious. They're not going to be able to get anybody else sick. And then that last one may still get sick, may still be contagious, but they're probably going to be considerably less contagious and considerably less contagious for considerably less time. And so what you end up with is, in addition to the spread being existential, the benefits, the downstream benefits of getting vaccinated don't just protect you and don't just protect the vaccinated person, but they stop that spread, and they protect a lot of other people from getting sick. So you can see, just like the virus is exponentially spread, those benefits accrue really quickly, and that continues as well. I think that's really important. I know that there's been a lot of discussion and a lot of concern about this, right? COVID vaccines are new, but they were made with ingredients and techniques that we've been using and improving for decades and even centuries. So while it's true that the time from COVID becoming an emergency to vaccines becoming available was faster than it is for most medicines, that's on purpose. That was by design. Just like when you're planning for a fire or an earthquake or a medical emergency, pandemic planning doesn't start when the emergency starts, right? The planning, the organizing, the testing is always ongoing, and it always builds on past experience. So these current vaccines that we have may seem like they're the product of just 6 months of emergency response, but the reality is that they are the product of thousands of years of studying and surviving plagues and pandemics, hundreds of years, literally hundreds of years we've been making vaccines and making progress with them. A century since the 1918 flu killed 50 million people, one of the most deadly pandemics in history, started the modern pandemic preparedness era. 60 years of mRNA research, 20 years, so since 9/11 was what really kicked off this need for, like, what if we have a mass casualty event, or what if we have a bioterror attack or some other event where there needs to be an expedited response. We need a medicine available for a large number of people quickly. What can we do to cut in line to say that this medicine is an emergency? We could do steps A, B, and C at the same time instead of consecutively. We could get to the front of the line instead of waiting in line for much more routine administrative requests. And then the last thing was the many thousands of brave volunteers from all over the world who rolled up their sleeves for these massive clinical trials. A lot of times when you're doing trials, they take a really long time because either you're testing a medicine that may only be minimally efficacious. You may be testing a disease that doesn't occur very often, or it progresses very slowly, or you may have limitations on who's eligible to participate in the trials. Well, none of those things was true here, right? We had very effective medicines. We had a disease that was moving very quickly, and just about anybody in the world over 18 years of old was eligible. And not only eligible, but we had tens of thousands of people that volunteered who ran into that burning building to give all of us a fighting chance against this horrible pandemic. And I think that when you put all that together, it's really easy to see COVID vaccines were quick. But that quickness was because of pandemics and because they're inevitable, because near misses have been so frequent, and because human history really is the story of those pandemics and how we can work together, not as a state, not as big pharma, but as a planet to overcome them. And I think that's a really important story and a really important way to consider how we got here. With over 60% of the US vaccinated, many people who are pregnant have been safely vaccinated. We know that. And what that means is that we have a lot of data that tells us that vaccines are very, very, very safe for pregnant people. And if you're pregnant, recently pregnant, plan to get pregnant, getting vaccinated against COVID is really important as soon as you can. And getting a COVID vaccine can protect you from severe illness. And a healthy parent is important for a healthy baby too, right? Pregnant people with COVID we are finding out more and more each day, twice as likely to be admitted to the ICU as people who are not pregnant, were put on a ventilator, and 70% more likely to die from COVID-19 compared to non-pregnant people. This is a really major problem. We really want to try to get the word out about that. I know that there's a lot of concerns, but in fact, this concern about not wanting to risk side effects or risk anything with your baby, it's much safer for your baby, for you, if you are pregnant, to get vaccinated as soon as you can. Pregnant people with COVID are also more likely to experience preterm birth, which is delivering earlier than 37 weeks compared to pregnant people without COVID. So please, if you know anybody, or if you're pregnant yourself and you're thinking about it, please get vaccinated, speak to your healthcare provider. But with the CDC really, really strongly, the more evidence we see, the more urgent that seems to be. This is one that I know that there's a lot of misunderstanding about, and some of it is just simple misunderstanding, but some of it is weaponization. We've actually seen this really malevolently misused. So the VAERS, vaccine adverse event reporting system, is a really important part of the story. One of the most important parts of monitoring drug safety long-term is tracking side effects and tracking adverse events. And since 1990, we have used a system for doing that called VAERS. And VAERS is a database that was created to track adverse events. And I circled the important part here, that may or may not be caused by a vaccine. All they are is things that happen after you get a vaccine, not because of. So there's a subtle distinction, but it's so important that I wanted to take a minute and put it in really big letters. And that is, adverse events are not the same as side effects. VAERS isn't, and has never been, a list of side effects caused by vaccines. So we've had literally hundreds of millions of people vaccinated in the United States. Some people in a population that large are going to experience adverse health events, just like some people are going to be in car crashes or get struck by lightning or get divorced after they get vaccinated. But that doesn't mean that any of those events were caused by vaccines. To identify side effects, you need to know if people are more likely to get in car crashes or get struck by lightning or get divorced after they get vaccinated, or any of the other adverse events that happen. And there's scientists who study this really closely because they want to know, and we all want to know, are vaccines more likely to make you have any of these specific adverse events? And what we know really confidently, both from the 30 years that VAERS has existed and from mRNA in general, is, again, vaccines as a class of medicine, because of the way they work, are some of the safest medicines we have. We've been studying them for centuries. We know that they don't stick around in the body. We know that they don't continue to operate in your system. And we also know that side effects, serious side effects in general, are very rare, and long-term side effects that happen, years or decades down the road, are almost unheard of. The way that these things work, usually vaccine side effects show up within a month or two. And because of that, we've been, tracking through clinical trials for well over a year. So we have a really high level of confidence that we understand what the frequency of these side effects is. And that's been misrepresented by some people that say that they see all these, people have died and that's been reported in VAERS. That doesn't mean they died because they were vaccinated. You need a lot more information to know that. Now, on the other hand, we are learning more about the long-term side effects of COVID every single day. And those include things like heart disease, respiratory, cognitive, sensory, neurological damage, even in younger people and even in people with milder initial cases of COVID. So our key takeaway there is vaccines continue to be a really critical layer of protection. And if you're looking for odds, your odds of being safer long-term are definitely better if you get out there and get vaccinated than if you take your chances and roll the dice about whether you are going to meet COVID unvaccinated or not. So we're all experts on COVID. I want to talk a little bit about a different kind of virus, and that's viral misinformation. After all, there's a reason that we call it going viral. Viral misinformation spreads just like viruses spread. Once it takes hold, it's very sticky. It multiplies very quickly. It mutates. It becomes more contagious and harder to stop. And just like biological viruses, prevention is more important than trying to minimize the damage once there's community spread. I like to encourage people to think about this, right? Facebook, YouTube, two of the biggest sources of misinformation and confusing information out there, a couple of the most profitable companies in the world, but they provide us a service for free, right? We don't pay to use YouTube. We don't pay to use Facebook. Well, what should we make of that? What does that tell us about the business model? Well, for starters, it tells us that we're not the customers, right? We're the menu. Our attention, our fear, our anger, our outrage, our clicks, our comments, our likes, our shares, that's what Facebook sells. That's what YouTube sells. And we don't even know who they're selling it to most of the time. They're not incentivized to educate us. They're not incentivized to tell us the truth. They're incentivized to keep us confused, to keep us clicking, to keep us entertained. And what keeps us clicking? Novelty. Right? Things that are novel, things that are outliers, that's what gets attention, things that confirm our priors as well. So we're not going to reform that. We're not going to fix the social media economy. It's really broken. It's a huge problem. But I think some small things we can do to better understand and limit its information, use good social media hygiene, is really important. I think the social media misinformation pandemic is just as dangerous right now as the actual viral pandemic. So a couple of things. For starters, if it's not really easy on a website to see where a claim originated or who wrote it or the staff of the org that runs the site, Or if they use vague terms like a major new study or experts agree or a trusted university reported without telling you who any of those things are. Or if someone is a lawyer or a computer scientist or has some other credentials that might not be like super relevant to public health or epidemiology or virology, and they're making these really outrageous claims or outlier claims, I think it's prudent to be really skeptical of those conclusions and seek confirmation out elsewhere. It's not that public health systems are never wrong. It's not that our systems for coming to conclusions are never wrong. It's that there's a really high burden of proof for new claims, and a handful of novel conclusions made by people that may lack relevant credentials don't mean that we should change course on the entire ship. And that's really important to keep in mind and to remember. So what the other thing is, when you do see that misinformation, don't engage. I know it's tempting. I know we see things that we get angry about, and we're like, that's so stupid. I want to correct this person. I want to send them a link to the right thing and post on there as a comment on their post. It doesn't help, right? All that does is ensure that more people see that comment. When we engage, the algorithm just elevates it. It means that more people are going to like it, more people are going to engage with it. There's a report button. I use it pretty liberally when I see things that are concerning, especially when there's things that I, as a professional, know are lies or are dangerous or going to get people killed. Sometimes it works, sometimes it doesn't, but I think it's probably the best strategy for responding to misinformation. If you're engaging with it, you're amplifying it. You're just ensuring that more people are going to see it, and that's going to make it spread more easily, whether you're arguing with it or supporting it. Now, this one sounds kind of obvious, but I think it really matters. Engagement is the currency of social media platforms, right? So like it or not, they have an outsized control over our reality. And you can't correct all the misinformation and disinformation out there by engaging, but we can seek out credible stories and engage with them and amplify them. Department of Health, our partners, are doing a really hard work of sharing evidence-based, easy to understand visual storytelling. Your engagement helps that compete. If you see things on there, give them a share, give them a like, engage it. It really does help us compete with the stuff out there that's doing a lot of harm and a lot of damage. And that's unfortunately the best way that we can compete right now for the information war. And finally, on that front, if you're like me, I'm sure a lot of folks on this call, if you're one of those people that is convinced by the science and you do trust the science, you're probably frustrated with misinformation. And it can be really tempting to joke about COVIDiots. We hear that term, people are COVIDiots, or they don't care about their families, or they deserve what they get. That's the one that really, really upsets me. Anybody deserves what's happening to them just because their beliefs. There are a lot of reasons and a lot of lived experience and culture behind people's beliefs and values and relationships with the state and with our health systems and with big pharma. And when we shame people for those histories and for those beliefs, we're alienating them. And one thing that we know for sure, is that misinformation and disinformation and conspiracy theory thrives on validating people who feel disrespected or unheard or unlistened to or shamed by mainstream information sources. So if our goal is to get as many people vaccinated as possible, as tempting as that is to kind of snicker or laugh amongst ourselves, we got to be really careful about not alienating anybody, because they may not be available now, but at some point they may very well. And it's already hard enough to change your mind about something that's really important to you. And so we have to do everything that we can to make it easier when that time comes for them to be able to say, you know what, I think I want to reconsider this. Because again, think of a time when you've done that. It is really challenging. It is really scary to do that. So I want to close real quick. If you took away anything today, I hope it's this. COVID-19 coronavirus replicates very quickly. It adapts very quickly. It mutates very quickly. It is invisible to us until it's too late. I keep hearing in conversation this debate. This is another of these misinfo things. Maybe it's not even misinfo. Maybe it's philosophical. But I keep hearing about, should we trust vaccines or should we trust our immune systems? And I think, based on what you've heard for the last half hour, hopefully you recognize that that's not maybe the most useful way of looking at vaccines. They're not competing with our immune systems or replacing our immune systems. They're helping them do what they do and what they want to do. But I also want to talk a little bit about our immune systems in general and whether we should trust them. This is my dog, Ivy. Ivy, every time I take Ivy on her morning walk, if I'm not careful, she will find and snarf down the most disgusting, rotting 3-day-old street trash. The stuff the stuff that she eats, if I give her 2 seconds, would kill me in a couple of hours if I try to eat it, right? And she gets less sick than anybody I know. She's got a better immune system than any human being I've ever met. There are entire countries where I can't drink tap water because of how inadequate my immune system is. There are people in my family who have to take pills every day because their immune system is trying to kill them, right? It happens to a lot of us. We have overactive immune systems. All that is to say, there are limits to how much I trust my immune system on its own and how much we should all trust our immune systems, right? Because we're not actually all that remarkable physically as a species, right? Compared to a lot of other animals, we can't fly. We're slow swimmers. We can't hold our breath very long. We don't have great claws or teeth for hunting. Our temperature tolerance is so narrow, and our immune systems really are not anything special. And we've survived and thrived so long by overcoming our physical limitations and our fragility. And we have two really important advantages. They're the advantages that make us human in the first place. We make tools, we tell stories, and we pass down those tools and so stories, and we refine them, and we make them our own. We make them reflect the places that we're from and the times that we live in, because we don't cross oceans with fins. We build boats. That's what we do. We don't fly with our wings. We build planes. We fly in planes. And we don't survive pandemics on the strengths of our immune system alone. We survive them because of vaccines. It's almost impossible to overstate the magnitude of life that has been saved by vaccines over centuries that we've been using vaccines to prevent the spread of disease. The story of pandemics, story of inevitable catastrophic disruptions, they brought us to our knees over and over again. The story of pandemics, or excuse me, the story of vaccines is the story of cooperation, of selfless volunteers, of generations of inherited knowledge passed down from scientist to scientist that is so much bigger than any one government or any one corporation or big pharma. It is our shared story. And COVID has reminded us how connected all those stories are and how the past shapes us and how it got us here. And that means that there's still plenty of people that we can reach who have stories and who want to be heard and who may find comfort and may be inspired to take action if they hear our stories and if we tell them well. So with that, I would love to thank you for listening to my story for a little bit here. And thanks to Jacob, and thanks to all the representatives and Senate folks and council members for having us here tonight. And I do want to, I don't know if my colleague Telly is on, I'm going to unshare my screen. And if Telly's here, I know that she wanted to share with everybody a little bit as well. And if she's here, I'm going to give her throw the mic at her for a second. Telly, are you on? Did you make it?
I don't think she is on, CJ.
All right, well, let's go ahead then. So that's it for me. I wanted to throw it back over to the group. Maybe she'll jump on later and we can throw it to her. She's got some information about some specific events upcoming. But I really wanted to make sure that we had plenty of time for questions and for conversation and specifics. I do have a couple of colleagues on who can talk about things that are going on with school and other planning things that are going on. So we could throw things in the chat. I see a couple of things in the chat already. Or I don't know, Jacob, did you want to do hands or chat only?
You know what, let's do chat only. So
Okay.
if you do have questions, please put it in the chat. But we did get one question in the chat from Angela. Angela's asking, is it mandatory for people with natural immunity to get vaccinated, people who have already been infected by COVID? I think that's a great question that I've also heard a lot from folks, that they already got COVID. So do they need the vaccine?
So nothing's mandatory, you know, generally speaking, right? There are some places that require it, but what we are concerned about, I think what's the question that as a public health professional, rather than a policymaker, the question that I can answer is, are you safer and are you better protected if you get vaccinated, even if you already have natural immunity? And the answer to that is yes. There's a lot of inconsistency to our understanding of how strong and how durable what we call natural immunity is, and natural immunity is that immunity that you get when you've already been sick and recovered. So what we do know is that we have seen people get reinfected and sometimes get much sicker within as little as 60 to 90 days after initial infection and not being vaccinated. So we think that based on this, and this is one that whips around a lot. We've seen a lot of kind of extreme studies on one side or the other that natural immunity is better or vaccine immunity is better. The bulk of the evidence, the conservative read right now, is that you are much better off, you are much safer if even after you've already been infected, if you take that additional protection that a vaccine provides. And again, that information may change. It certainly doesn't hurt. What we're actually seeing, and what's actually suggested, is that you might actually have super immunity. You may be very, very robustly immune if you have been recovered, have that natural immunity, and then also get your normal course of one of the available vaccines. But yes, we definitely would encourage everybody as a public. Again, I'm going to avoid policy questions because I work for the health department, and I guess we have some electeds on. So if any of you guys want to jump in on policy stuff, but in terms of the public health, I'm pretty confident that we would really encourage people, even if they've been sick, to still get vaccinated.
CJ, there is another question from Claire, and Claire is asking, how long does someone have to wait after COVID to get the COVID-19 vaccine?
As soon as you're clear, you're eligible. There's no necessary waiting period. Once you're no longer contagious, once you've tested negative, once you've been 14 days since your initial diagnosis, any of those, you're fine. I would say that it's kind of a walk, don't run, right? The chances that you're going to get sick again in that first month or two are pretty low. But maybe when it's the first time it's convenient for you to get back out there, probably worth your time to do that. But again, don't walk around in tremendous terror that the 3 days after you are out of quarantine that you're going to get sick if you don't get vaccinated right away. But there's no downside to getting vaccinated sooner than later.
CJ, I do know that there are a lot of folks out there who are also interested in what's being done with the school. So I know you said you did have some folks from the Department of Health. Do you know who it is, so I can give them the...
Let me double check. I saw somebody earlier. I believe my colleague, Kat Center, is on the call. Kat, are you there?
Okay, let me give her the ability to... Okay, Kat, you should be able to unmute now.
Yes, I'm here. Hi.
Yeah, Kat, can you just share kind of what's being done in the schools? I know early on, back in August, a lot of the concern was what is being done to protect our students in the schools. And I know you folks have been working closely with the Department of Ed on that. So can you just share some of what's been going on?
Definitely. There's a ton that's been going on in schools. The Department of Education and the Department of Health have been working since the beginning. The Department of Education has done a remarkable job of implementing mitigation procedures, all of the things that we've been seeing across the state. They've been doing in every school, figuring out distances and masking policies and cleansing and all of those things. So they've been doing a great job. We have been advising them along the way and providing guidance for them along the way. And we are in constant communication. We're ramping up starting, I think, in July or June, starting school-based testing programs. There's several different programs that have either started or we're working to start across the state to provide testing. This is screening testing just to make sure that we know the amount of COVID that might be in the community, testing students and staff and anybody on campus. And we're also working on new programs to provide more long-term support to programs for students in schools like Heiki nurses.
Thanks. CJ, this next question might be for you, and I know you sort of covered it in your presentation, but the question is, what is actually in the vaccine?
Oh, that's a great question. I just made a slide. It's going to take me a second to pull up the slide here. So I'm going to stall because we get this one a lot too, right? Hold on, let me pull this up real quick. It's actually really simple. There's some complex formula names, but it breaks down to just a couple of things. I got my slide pulled up and all right, let me align this real quick. So this is the actual ingredient list for Pfizer. The Moderna is pretty similar to this, right? Let me make sure that's correct. Can you see that whole thing? I've broken this down into the 4 types of ingredients and color coded it. So there's really only 4 different types of ingredients in the Pfizer vaccine. There's the messenger RNA itself, which is just what it says. It's a protein, right? The mRNA protein. The second is that it uses a lipid solution to essentially protect so one of the things about mRNA is that it's really unstable. It's fragile. It doesn't survive or last very long once it's out in the wild. That's why we keep it frozen, right? When that's one of the big challenges of getting it around. So once it's unfrozen, once it's at room temperature, it doesn't stick around very long. And one of the ways that scientists have figured out to make it a little bit more durable and to help it find its way into our cells is by encasing it in a fat, in a lipid nanoparticle. So that's that pink things, all those are as fancy names for different fats. And then the third thing is electrolytes, so salts and potassium. And those are different solutions essentially to manage the acidity in your body. And that one I actually maybe would defer to a scientist specifically on what it is, but really it's not a preservative. I think that's the really important thing. These are really just electrolytes for acidity. And then the third thing is for sugars for freezing. So when we do freeze it to protect it as it's frozen and then unfrozen, they use sucrose essentially. So there's some of those words are big words, but they really break down into 4 separate categories. And that's all that's in these vaccines is the mRNA itself, a lipid to protect it, electrolytes for stability and for acidity, and sugars for freezing and stability when it freezes.
Thanks. So some of the questions we're getting on social media is in regards to the next step for the vaccines, right? So I know Pfizer, the booster shot has been out for a couple of weeks now. One question that we got from somebody was, when can we expect Moderna and or J&J? I think that's the key question a lot of us have been waiting for.
Yeah, I'll take a stab at this. I know Catherine knows some stuff too, but I think the short version is we're going to see a flurry of new emergency use authorizations and new approvals over the next 2 months. A lot of stuff's going to happen. We're going to see. So as you know, right now, boosters are available and approved for Pfizer only. But like you said, all of the other 2, Johnson & Johnson and Moderna, have both filed for approval, and we anticipate those are probably going to go through. We're also likely going to see Moderna, at least, I don't know about Johnson & Johnson, but go down to 12 and up. Those trials are happening right now. We're also very likely, probably, I mean, in the order of the next couple of weeks, we're anticipating seeing 5 to 11 for Pfizer approval. And that's the one where we're really spending a lot of time right now is preparing for that and making sure that people feel comfortable and people feel like they have good information for that. So I would say in the next month, pay very close attention because there's a lot of things that are going to happen. There's no guarantee. There's a bunch of FDA hearings happening just in the next couple of weeks that are going to decide a lot of these outcomes. We have pretty good confidence in which way they're going to come, which is a lot of new approvals. But the really important things for us are not the boosters. I think, and we can talk about boosters if anybody wants to get into more detail about it. But I think our position on boosters is walk, don't run. They're not our biggest priority in terms of protecting the community. Our biggest priority is continuing to vaccinate those people that haven't even initiated. We really want to convince the rest of the population to take that step, to commit to it. I hope that as more people get vaccinated, it norms more, the fear goes a little bit away, the normalization occurs the way we hope that it's going to. And then also we really want to make sure that parents feel comfortable and that they have the good information that they need to get their kids vaccinated, because that's going to be really important. Remember, when we showed earlier, there's a huge difference. If you look at the entire population that's vaccinated, which is around 70% now, versus 91% of eligible, right? That's because 20% of that population is not eligible for vaccination. And that's our 12 and under. So in order to get to this position where we're curbing spread significantly, we're really, really, really making COVID really hard to move around in the community, we're going to need to get a really good portion of those 5 to 11, and then keep going with the other age groups. We are still hoping to see higher rates, and although we're making really good progress, we're hoping to see more 12 to 17 and then more 18 to the 40s is where we're not as great as our 60 plus is doing great. They're highly vaccinated. Kate, did you want to say anything about that?
I just wanted to add that we've always had boosters. The last time I went and had my checkup, I had to get another tetanus shot. We get that booster every 10 years. Flu shots, we get those every year because, like COVID, flu mutates, and we need a new vaccine every year. So boosters aren't new to COVID, and I see in the chat a question about, is the Pfizer booster different from the first shots? It's the exact same medicine or the exact same vaccine, same ingredients and everything, just a little bit more for your system to produce that immune response that we need.
I have a question.
Senator, go ahead.
Yeah, so you received the third Mrna shot, right? Is it the equivalent of getting a booster, or is it just you got another shot of Mrna? That's all it is.
So we distinguish between additional doses and booster doses. So the difference is, so booster doses in the general population, you get your initial vaccine course and you generate an immune response, and that immune response plateaus for a certain amount of time. We don't have a ton of confidence how long that is. We know that we're monitoring. Obviously, there have been people in clinical trials, tens and thousands of people were in clinical trials, but over a year ago. So we have some sense that it lasts at least a certain amount of time, and then we are seeing mostly age-related drop-off, and then again, this is one of those things where there's a lot of noise and a lot of confusion in some of the information, but we are seeing that it's consistent for at least this amount of time. Additional doses are a little different. Additional doses are for folks who are immune compromised. So either because they have immune disorders or they're on immune therapy of some sort, and they may have never developed a really, really robust immune response in the first place. The additional dose just helps kind of keep it churning along, keep it going. So those are, Kat, help me out with this one. So we have been doing additional doses for Moderna all along, well, for the last couple of months anyway, and Pfizer, but the only booster dose that's authorized so far is Pfizer. So they're a little bit different. I mean, they do the same thing, but maybe the person who's getting it is the difference between an additional dose and a booster dose. But anybody that is immune compromised, either from therapy or from immune disorders, is eligible for that additional dose if they got Pfizer or Moderna.
Thanks, CJ. We did have a question from Larry. So Larry, you should have the ability to take yourself off of mute now and you can ask your question. Thank you for being patient.
All right, I'm finally on mute. Thank you very much, Jacob. I didn't have a question. What I just wanted to say was this was truly an outstanding educational presentation. CJ, you have the passion for delivery for this very important information. I would love to see this on the Lelo channel every single day, twice a day. I would also see this given to the students at all the high schools and maybe even in the elementary, because you've got it down to a half hour. Perfect. But you covered from A to Z all the way through. And I'm just trying to think, because, tonight's forum, we tried to get more and more of the community involved. But, a lot of people are hooked on their TVs, and there are people to channel hop and do get on a Lelo. And I just want to commend you for being so smart and all this stuff. I just wish I could do more to try to get people to, take 30 minutes of their time and listen, come on to a town hall meeting. But I really think that what you just did tonight and what's recorded, we can multiply so much getting it out the other way. And the other thing is, I've got my booster, and I thank goodness Kaiser got me in. I'm happy with that. But you guys are on track. Keep up the great work. And I just want to put that input in from the Pearl City Neighborhood Board.
Thank you so much. That's very kind. I'll just to do a little bit of shameless self-promotion. The reason that I've been presenting well as I've been doing it a couple hundred times in the last year. I present just about every day. And I mentioned this a little bit in passing, but our focus is generally, I'm always happy to do public facing stuff. I do some like ARP, and I'm happy to do school stuff. I do a lot of train the trainer. I do a lot of outreach to faith leaders, community leaders. It's really important to us, I think, as we get into this population where there's this diminishing returns on people that are yet to make the decision to get vaccinated, they're less likely to listen to me. right? They're probably not going to take a Tuesday night and show up and spend a half an hour listening to this guy talk about vaccines. But all of you on this call, especially our elected friends who I'm really grateful are here, educator friends who I'm also really grateful are here. You guys do have positions of authority, and you have positions of influence. And so one of the things that's been really important to me is we have really, really great sophisticated media apparatuses that get the messages out on our networks, on the radio and in print and all these things. But what I really focus on is trying to make sure the folks that aren't plugged in there, whether because of a language barrier or because of cultural distrust of these mainstream institutions, that they feel empowered to talk about it. So all that is to say, A, all of my materials are free for anybody to use. If anybody sees anything they like, happy to share it. B, if you're involved in a faith group or a community group or a cultural group or a neighborhood board or anything else, please feel free. I'll drop my email in the chat, and I'm happy to set up a time to meet with your group and to give that presentation and then answer questions just like we're doing now. So thank you so much for your kind words. I really appreciate it.
We'll take a few more questions, but I do see that Angela has her hand raised. So Angela, you should be able to unmute now.
Hey, CJ. Yeah, I was wondering, I don't know about the procedures. Great presentation, by the way. So, but about the procedures and processes for how the DOH operates, I don't know about that, and about how the officials create emergency orders. So correct me if I'm wrong. I've only studied a little bit of veterinarian science and know a little bit about medical knowledge. But my question is, why is the government moving so fast with emergency orders when science, nature, disease, and the study of medicine, pathology, and scientific data does not work that fast, right? The government was rapidly mandating emergency orders left and right. But from what we know about science and medicine, the study of disease, pathology, it cannot be effectively assessed at the same speed. We saw the disease evolve into its current form, the Delta variant. And for people who know about science and medicine, clinical studies take months to develop. And then to get the data assessed and synthesized from the clinical studies is another process in and of itself.
So there's two questions. There's two ideas in there that I want to parse out a little bit. One is the policy mandates and the emergency orders. So I am a public health educator. We don't make emergency orders. The executive makes an emergency order. So, and I very, very specifically feel like I can do my job better. I can be a better educator if I don't talk about and I don't respond to, or I don't try to defend or criticize, on the other hand, executive orders. That's a different branch. They have representatives. You can reach out to them as well. The second piece is speed. And I talked about that a little bit earlier, and I think it's a good point. But I also think that it's really important to remember that none of the processes that we're describing here started a year ago or a year and a half ago. There are people, and I work with them, and I've been working with them for most of my career, and I've been involved with emergency management for 20 years, who have been preparing for this eventuality for hundreds of years, right? Pandemics have been one of the most existential threats to humanity for all of humanity. And then again, 100 years ago, the 1918 pandemic really, really, really caught a lot of people, caught all of humanity to say, we can't let this happen again. And so everything that you've seen spring into action, all of the advice, all of the studies, all of the processes that have sprung into action in the last year and a half were planned for, not all of them. I mean, we've made mistakes. We're learning as we go. Nobody alive has survived the pandemic of this scale before, but we have had these plans have been in place and are being executed. And I think the idea that we're overreacting or not considering these things, it takes for granted, or it takes as an assumption, the fact that there aren't people, emergency planners and pandemic preparedness professionals, who specifically have been working on what is the best policy. And frankly, a lot of us wish that we had been quicker and more robust. I mean, there are playbooks for how you do this, right? And because of economic pressures and social pressures, because we don't get to make the rules, if we made the rules, we would, we might have made them a little bit differently. We might have had a little bit more robust response in terms of how you can allocate resources, how you can get things done quickly. But so to the idea that it was done too quickly, I think we can really, really vigorously and robustly defend the clinical trial process. I can really robustly defend emergency use authorization, which again, emergency use authorization came after remember the anthrax attacks? I don't know if you're old enough to remember the anthrax attacks in 2004, but in 2004, there was a bunch of anthrax that was mailed as a terrorist attack in the US around the country to elected officials in the Capitol. And after that, the Department of Homeland Security, FDA, CDC, a bunch of other organizations said, we need a plan. We need to figure out what happens if there is a large scale public health emergency that requires new therapies, new therapeutics, new drugs, because we're not built for speed. We need to have a different process. When your house is on fire and the fire department comes to your house to put it out, they don't have to wait for a warrant, right? Because your house is on fire. So they can break down your door and put the fire out because that's for the greater good. Well, the same thing is with them, but that doesn't mean that there's not rules, right? They still follow rules. Those rules are called exigent circumstance. And they have very specific limitations on what they're allowed to do in an emergency. And in that emergency, they're allowed to do this, but not do this. Emergency use authorization is the same thing. This is an emergency drug. It shouldn't have to stand in line for the same amount of time to get approval that a routine cold medication does. Right? And so all of these things were put in place very carefully, very specifically to have an emergency response. And my colleague Kat has her hand up, and I know that she is actually a planner and preparedness planner. So I would love to hear her thoughts on this as well.
Thanks, CJ. And Kat, before you go, we're going to make Kat the last speaker because it is almost 8 o'clock, and I promised I'd get everybody out of here before 8. So Kat, you'll have the last thoughts, and then we'll wrap up.
Okay, I'll try to be quick. To piggyback on what CJ was saying, it's like when an ambulance comes up behind you on the road and everybody diverges to the side. We worked really carefully to get all the obstacles out of the way in vaccine preparation in the last year and a half. So we didn't skip out on the science and the safety and the efficacy and the clinical trials. But what we did do is we got those barriers out of the way, and we made sure that the second the data was going to, the day we were going to have enough data, we had those meetings scheduled, which isn't normally how it works. That they didn't have to wait in line. They didn't have to wait for scheduling. They didn't have to wait for people to agree on something. It just was ready to go the second that those vaccines met the next threshold. And so we got those barriers out of the way. I'd also say some of the mandates were things that we've been using to slow diseases for centuries, like isolation and quarantine. Those are really old concepts. They used to mark people's doors or leave signs to tell people that this was a sick house and not to go in. So those and masking, those are things that we've known for hundreds of years, that those can slow diseases. And one last thing I'd like to say is we know that these are personal decisions, and people are most persuaded by people they know personally. So if I can encourage everyone that's listening to us tonight to just talk to one other person that's on the fence or undecided, and maybe we can all be agents of positive change.
Thank you. And, really want to give a big thanks to CJ and Kath and the hard work that they're doing with the Department of Health, and for taking time to come out and do their presentation. I also want to give a shout out to our hosts for tonight, and there's a long list of them. So make sure I don't miss anybody, but we have Representative Aaron Johanson, Senator Bennette Misalucha, Councilmember Brandon Elefante. We have Senator Clarence Nishihara, Representative Gregg Takayama, Representative Roy Takumi, Representative Sam Kong, Representative Sonny Ganaden, and Councilwoman Radiant Cordero. And just making sure I didn't miss anybody, because I'll get in trouble if I do. But yeah, no, that's all of the electeds that we have on the call tonight. I really want to thank them for their hard work and for all that they
Can
do
we take
for
a
our
photo,
community.
Jacob?
Yes, and before we leave, we're gonna take a photo, but before we get to the photo, one last piece of information. I do want to share that there are going to be pop-up events in the ʻAiea Pro City neighborhoods. On October 22nd, there's going to be a pop-up event at the ʻAiea Hangwanji from 4 p.m. to 8 p.m. and October 29th at Pro City Community Church. And the reason why it's 4 to 8 is because we recognize that many of us work during the day and don't have the time to leave. So our elected officials and our community leaders wanted to make sure that there was an option for those who may be on their way home from work to stop and get a vaccine. So October 22nd at ʻAiea Hangwanji and October 29th at Pro City Community Church. But really wanted to thank everybody for coming on, and we'll do a group photo. So if you can all turn your cameras on, put some big smiles, and give me a sec as I get this ready. On a count of 3, you're gonna hold it for about 10 seconds. So, okay, ready? 1, 2, 3. Okay, got the first one. So gotta get to the second page. And got it. Thank you guys. Okay, so that's it for this evening. And if you have any questions, CJ did put his email in the chat, but I also put my email there. So if you have any follow-up questions that you want to get answered, please feel free to send me an email, j.aki@capital.hawaii.gov, and I'll make sure that I can point you in the right direction. So that's all we have.
Give Jacob a big round of applause for being such a good facilitator as well. Good job. Well done, Jacob.
Thank you guys.
Mahalo.
Great job.
And I'll give you folks your Tuesday evening back. So have a great night. Stay safe, and we'll see you guys soon. Aloha.
Thanks, everybody.
Aloha.
You guys all get a thumbs up.